place where new
I like to
graduates
be
and immigrant
educated,
nurses learn how to
but
successfully
I'm so
navigate the
frustrated.
complexities of the healthcare system and break the barriers that limit them from succeeding. I'm Bernice Odudu, and I work with new graduates and immigrant nurses to develop confidence, get over cultural shock at work, and improve their careers. Episode 8 is how new graduate and immigrant nurses can prevent lawsuits. Every nurse needs to be knowledgeable about dangers involved in the daily duties. Unintentional behavior could be interpreted as professional carelessness or violation in a court of law. The outcome can range from co-workers and the organization losing faith in you to losing your job and revoking your license, even receiving a jail sentence. Because of this, new nurses must uphold the standard of care, the code of ethics that guides their professional behavior, as well as the policies and procedures of the healthcare institution they work for. Patients, family, co-workers, and organizations may be impacted by these malpractices. In the nursing sector, recent graduates or immigrants may not be familiar with liability issues and hence may be more susceptible to unintentional violation. As a result, they must stay informed and familiarize themselves with the laws and rules that govern the nursing profession. The Nursing Service Organization has predicted that the average registered nurse malpractices suit will cost around $210,513. In one of the Western nations, a nurse was sentenced to prison for carelessness in a case. The reporter claims that an immigrant nurse was caring for a baby who was having respiratory problems. However, rather than administering CPR or dialing for help from an expert, the nurse chose to pray. The nurse received a lengthy prison term after the infant passed away. Nurses have received prison sentences for similar wrongdoings in numerous instances. Let's examine a situation that might lead to a legal action. Details of the case. A male 79-year-old patient who had previously experienced a stroke and was now left-sidedly weak. Because of his uncontrolled hypertension, he was admitted to an inpatient medical surgical facility. However, the patient was given permission to get out of bed with an assistant to use the restroom. He has been working while receiving physical therapy as part of his recovery process. The patient's weakening and inability to keep balance with the walker were noted in the nurse's note 2 days following his admission. Even though the doctor was informed, it was unclear whether or not the patient had been seen. The patient care was taken over the following day by a nurse who had previously been off duty. There was no mention of the patient's progressive weakness during the handoff. Unaware of the patient's deteriorating strength, the nurse attempted to get the patient out of bed. The patient tripped and his head banged on the bed rail. With a deep laceration on the left side of the head, the patient lost consciousness. A head bleed was discovered with CT scan. The patient was upgraded to ICU, where he passed away 3 days later. The 4 legal elements needed to prove nursing malpractice in this situation are as follows. 1. Does the nurse have a duty to this patient under professional standard? Did the nurse violate this obligation? Was the breach to blame for the harm? Has the breach caused any harm? The cause of this case will be decided by thorough response to this question to determine if the nurse's actions contributed to the patient's fault and subsequent death. The Nursing Practice Act, the Code of Conduct, and the organization policies and procedure will be examined. Let's go over some of the highlights in this case. The first question is, does the nurse have a professional obligation to this patient? According to Provision 3.5 of the American Nurses Code of Ethics. It is every nurse's responsibility to protect the health and safety of the patient in their care by acting on questionable manner. Therefore, the nurse has a professional obligation to keep these patients safe from harm. Number 2, did the nurse violate this obligation? Every patient under a nurse care has a professional obligation to be protected from injury or harm. Before beginning any task, a reasonable nurse must use critical thinking to ascertain whether the patient is capable of carrying them out. A comprehensive physical examination by the nurse will have shown the patient's inability to sustain himself. An inquiry of this sort should follow. What is your name? Are you aware of your location? Who is the American president? When was the last time you went by yourself from bed? Did somebody assist you? Can you raise your legs up for me? Put your legs up against my hands. The responses to and findings drawn from this question may have revealed information about the severity of the problem and perhaps made a call for help prior to getting the patient out of bed. The fall was caused by a failure to assess the patient, which is a violation of the obligation to keep the patient safe. 3. Was the breach to blame for the harm? The patient's fall was caused by the nurse's neglect of a physical examination before the incident. The nurse would have known to investigate further at the handoff if she had evaluated and studied the prior nurse's note. The strategy was to either ask a co-worker to help her to explain to the patient why she needed to complete all the activities while lying on the bed. The nurse didn't make a help request. The nurse violated her duty by failing to assess whether the patient could benefit from one person's assistance, which led to the harm. 4. Did the breach cause any harm? Without performing an assessment, the nurse helped the patient from bed. The patient lost his balance and hit his head against the bedside rail, sustaining a head injury and dying as a result. The nurse made a serious error that contributed to the patient's death by failing to evaluate the difficulty of moving the patient out of bed. In this scenario, the attorney for the defense will need to put in a lot of efforts and take several steps to help prevent lawsuit from occurring. Here are some key tips. 1. Practice within the scope of your training and education. As a nurse, you are expected to practice within the scope of training and education. This means you should be knowledgeable and only perform tasks and procedures that you are trained and qualified to do. Avoid attempting tasks or procedures that are new to you without assistance. 2. Follow established policies and procedures. Nurses should follow established policies and procedures in their workplace. This includes documenting patient care accurately and thoroughly, reporting any unusual occurrence, and following protocol for medication administration and other treatments. Avoid shortcuts. Maintain good communication. Good communication with patients and their family is essential. Nurses should communicate effectively and empathically. Explain procedures and treatment in a way that patients can understand and encourage patients to ask questions. Practice good documentation. Documentation is crucial for nurses to provide legal protection. Good documentation is clear, accurate, and timely, and should include details such as vital signs, patient responses, and treatments administered. 5. Report incident or error. If a patient is harmed or an error occurs, it is important to report it promptly to your supervisor. This helps ensure that appropriate action is taken to address the issue and prevent it from happening again. 6. Attend continuing education. Education is important for nurses to stay current with the latest development and best practices in their field. This helps nurses to provide the best care possible and avoid errors or omission that could lead to lawsuits. 7. Practice good time management. Nurses should practice good time management and ensure that they can provide adequate attention to each patient. This helps to prevent errors and ensures that patients receive the care they need in a timely manner. 8. Have your personal liability insurance in case of any unexpected events. I have had mine with nurse service organization for over 10 years. A nurse must therefore stay informed and familiarize themselves with the rules and regulations that guide their practice. Ignorance is therefore not a defense. Thank you for watching. Please don't forget to subscribe, share, like, and activate the notification for new episodes. Remember, a caring heart makes a difference.